My name is Elisabet Perez. I have been working as a teacher. I have had over 7 years of teaching experience in history, theology, and ethics in a non-for-profit organization. During that time, I began to focus on nursing. I realized nursing was something that I really wanted to do. And when I graduated as a nurse, I began working in Baptist Hospital in the Miami Cardiovascular Institute. While I was there, I not only saw patients with cardiac-related conditions, but I also had the opportunity and the experience to learn about patients that came in with other conditions, such as medical surgical patients with abdominal pain, patients that were transferred from the intensive care unit once their conditions were getting more stable into our unit as well. And I also had the honor of working in the rapid response team, where we took care of patients that came in with that had a lot of clinical deteriorations. So after that, and I would say during that time as well, I studied for my family nurse practitioner, and I am now a certified family nurse practitioner as well. And this year I had the chance and this privilege of becoming part of FVI School of Nursing, and it has been an honor and a privilege. I am now working as a nursing instructor, teaching the skills laboratory for fundamentals. And we have been doing and teaching students that hands-on and practice experience of not only basic skills such as bed baths, but also skills such as how to perform appropriate adult system assessments, head-to-toe assessments. I teach them head-to-toe assessment, focus assessment, cardiac assessment, respiratory assessment, abdominal assessment. We also go into speaking and how to properly assess, do breast assessment, bed baths, how to change bed linens, which is, that basic fundamental portion. We have a mixture of fundamental skills along with health assessment skills that we're teaching our students so that they could be trained and they could be competent once they graduate to be confident enough to do that with the patients as well, which is our hope and our goal for them. What drove me to become a nurse is, it was during a couple of years ago, my mom got sick and I was in the hospital, and I was looking at the way that nurses were taking care of my mom, because I saw that the nurses were the ones that were there on the front line with the patients, advocating for the patients, and I saw the way that they took care of her, and I realized that that was something that I wanted to do, that I wanted to be there for the patient, and I wanted to help them during their most vulnerable times when they were sick, and being able to do that for them. And that's what drove me to go into nursing and to study nursing. If they want to make a difference, if they want to be able to help others in their time of needs, to go for it, to look into our program, look into the FVI School of Nursing program. It's a 22-month program. We go into those basic classes such as anatomy and physiology, as well as those nursing core classes that include the fundamentals, the pharmacology, to be able to train them and to teach them appropriately so that they could be that competent, professional, entry-level nurse.